Hello and welcome. My name is Dana Vinay. I am a nurse practitioner student with United States University. This video is for our advanced physical assessment class, and I will be performing an abdominal assessment. First things, I'm going to do a 360 of my room, and then we'll sanitize our hands, identify our patient, and we'll begin. To note, I am using an actual exam room, so there are some certifications on the wall that are not pertinent to our video today. Hi patient, how are you?
Good, how are you?
I'm great. I'm gonna clean my hands here while we're chatting.
Okay.
Can you tell me, I have to ask you a few questions for the purposes of this video. Can you tell me, are you above the age of 18?
I am.
And is it okay, do I have your permission to upload this, to record you first of all, and to upload this video to YouTube for evaluation by my professor?
Yep.
Wonderful. So we have our patient here supine. I'm going to take this pillow and I'm going to place it under her knees. This is going to make sure that we have the relaxation of the abdominal muscles. Okay patient, so what I'm going to do is I'm going to have you lift your garment there. We're going to take a peek at your stomach here, your abdomen. So the first things we want to do is we always want to inspect with our eyes first. So I'm inspecting the patient's abdomen. Her abdomen is flat. I don't notice any asymmetries happening here. I don't notice any incongruencies between either side. Her skin is intact. I don't notice any jaundice to her skin as well as to the sclera of her eyes. So after we've assessed with our eyes, then we're going to take a listen. So I'm going to listen in all 4 quadrants for bowel sounds. We should be listening for about 5 to 10 seconds in each quadrant. There should be some gurgling and sounds going on. So we have bowel sounds are present and active in all 4 quadrants. The next thing we want to do is we want to assess for the presence of an abdominal aorta. So we're going to listen here with both the diaphragm and the bell of our stethoscope for right here at the bifurcation. No bruit is noted, which would be a normal finding. The next thing we're going to do is we're going to move on to auscultating for our renal arteries. Our renal arteries are going to be notated at the vertebral border here. At the intercostal border rather. They should be noted about 2 inches off of the midline. And we're going to auscultate with both the diaphragm as well as the bell. No bruits are noted, which is a normal finding. The next thing we're going to do is we're going to move on to our iliac. Our iliac is going to be notated here at the line of the umbilicus. We're listening with both our diaphragm and our bell, and no bruits are noted. The next thing that we're going to auscultate for is for our femoral. For the purposes of this video, I am not going to expose our patient. In a real life situation, we would want to listen directly onto the skin to see if there's a presence of a bruit. And we have notated that there are no bruits notated in any of our areas or arteries that we auscultated there. So the next thing we're going to do is we're going to move on to percussion. We are going to percuss in all 4 quadrants. We should note tympany in all 4 quadrants. That would be normal finding. We're also going to percuss here down on the liver as well as on the spleen. We also want to note that there was no tenderness or any abnormalities there and that tympany was noted throughout. The next thing we want to do is we want to note the size of the liver. What we're going to do is we're going to percuss down. We should hear tympany. When dullness starts, that is an indication that we're on the upper border of the liver, and then we're going to continue to percuss down, and then we should notice tympany resume, and that will be the bottom. In an average patient for a normal finding, we are notating between 6 centimeters and 12 centimeters would be a normal finding of a normal liver size. So I noted it here is when the dullness began, and this is when the tympany resumed. So we're going to measure that here. For the purposes of this video, she's measuring about a 6.5, 7, which would also be a normal finding. After we percuss, we've percussed the liver, we've also percussed the bladder down here, and we've percussed the spleen. We're going to move on to palpation. We're always going to start with light palpation. We're going to be observing for any masses, any discomfort in those areas. We're going to percuss in all 4 quadrants, as well as palpate in all 4 quadrants, as well as palpating the liver and the splenic area to notice any abnormalities or tenderness. So we're going to go in with one hand for light percussion, for palpation rather. Any pain in any of these areas? No. So no pain is noted. I have not noticed any masses or anything of that nature. So next we will start with deeper palpation. Any pain? We're going to palpate again deeply in all 4 quadrants. We're also going to palpate here over the liver and over the spleen. And the patient is not grimacing, she's not expressing that there's any pain there, and I haven't notated that anything is abnormal. So once we've done that, we're going to move on to our special testing. So with our special testing, we're going to start with the fluid shift test. This test would be assessing for any ascites that will be located in the abdominal cavity. Obviously, this patient is young and otherwise healthy, so most patients that would have ascites, it would be noticeable, but for the purposes of the test, we will still perform the test. Fluid shift. So nothing was noted there, so no ascites is present in this patient's abdomen. The next thing that we're going to move on to is we're going to move on to the Murphy's test. For the Murphy's test, we're going to palpate here in the right upper quadrant. I'm going to have you take a breath in. Any pain? So that would be a negative finding for the Murphy's test. The next thing we're going to do is we're going to move on to the Roving's test. And with the Roving's test, we're going to apply pressure in the left lower quadrant and note if the patient has any pain in the right lower quadrant. Any pain there? Okay. And then for our final test, we're going to test our CVA for any tenderness. Any pain here? Beautiful. So all of our tests, of our special tests, are negative. That concludes our abdominal assessment. Thank you for watching. Again, we have assessed our patient, we've gotten consent, our patient is over 18, and we've cleaned our hands, and we've gone through all of our steps of our abdominal exam. Thank you very much.